You hurt your back. Oh gosh. What do you do next? Hello and welcome to the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is what you should do immediately after hurting your back. How do you know if you should go to the emergency room, if you should lay low, if you should seek rehab? What are the next steps? How can we put you in control so that you do not panic? You go down the right path, not the wrong path, and we save you literally 10 to 20 grand right now just with this podcast, okay? This is valuable stuff. So if you have not joined our private Facebook group yet, RehabFix Low Back Program is the name of our private Facebook group where you get exclusive access to me. You can ask me any questions you want. We have a step-by-step sciatica guide in there, and we also have other guides that we are posting on an almost weekly basis at this point for you to get even more exclusive information on how you can fix yourself and get out of that medical hamster wheel, actually get results, focus on results, and getting back to your life that you want to live. Go join the Facebook group, RehabFix Low Back Program, also linked in the show notes. So today's a really important topic. Why is today an important topic? Because a lot of people don't know what to do when they hurt their lower back. They're not sure what to do. And because they're not sure what to do, because the education is not out there, very, very, very often people will get sucked into the wrong path, sucked into the medical system, sucked into the cycles, sucked into all different kind of crazy treatment things that turn a acute issue to a chronic issue to a 5-10 year long issue. Where you end very much so is affected by where you begin. And I want to make sure you understand how to begin the right way, because this could completely change your future. Whether you haven't injured your low back yet, 80% of people alive will hurt their low back at some point. So either you're listening to this because you want to prevent low back issues and you haven't hurt your low back yet. This will prepare you for that. Whether you just hurt your lower back and you're kind of in this few days, maybe first couple week, this will help you. If you've been dealing with low back issues for 5 years, like our average client, then this will also help you as well. So let's get started. You hurt your back, okay? Whether you're bending over to pick something up, feel something tweak, whether you're at the gym squatting or deadlifting, you feel a pop, feel super stiff the next day, difficult to stand up straight, bending over to put socks and shoes on hurts, sitting for a long period at work hurts, driving to work, oh my gosh, that low back is irritated. What do? The first thing you do is you do not panic. You do not let the stinking thinking integrate your brain. You do not panic. This will most certainly make your situation worse if you panic. It will absolutely make your situation worse if you panic. I know it's easier said than done, but do not panic. Low back issues are very, very common. And people recover from low back issues every single day by taking the right action steps. It is not a life sentence to drugs and surgery if you start the right way. Okay? It's not a life sentence for those things. Do not panic. Assess your situation. I highly recommend you wait a few days before doing anything. And you might be like, what? Grant, why would you say that? Why wouldn't you say immediately come to you? I know, bad for business, right? It's a shame I'm ethical and evidence-based. But seriously, don't do anything for a few days. Allow the situation to somewhat self-resolve, self-heal, so then you can assess the lingering effects. Anyone who does anything, any type of injury in the body is going to feel it's heightened the most immediately after injury, right? Everybody knows that. So let things calm down a little bit to then assess, okay, what symptoms are lingering? What am I really feeling now? How long is this lasting? That's going to help you assess your situation. So I'm going to tell you first what a medical emergency would look like. And this is really important, okay? So if you hurt your back, feel something pop, okay, and the next day, you're noticing that one of your feet are really, really weak. Okay, it's hard to lift it up. It's starting to drag on the ground a little bit. Okay, that could be the early stage of something that we call foot drop, where there's usually enough nerve encroachment that it is cutting off the juice, if you will, to that region, to those muscles that control the lower foot. And that isn't a great sign. We have had a lot of clients who have had foot drop in the past and they were able to rehab and recover fully in our program. So it depends on multiple other symptoms, which I'm going to get into now. That is just one to add to the table. Additional symptoms that are much more serious than that would be paresthesia, or lack of feeling in your groin region. So we call it the saddle paresthesia. Okay, imagine you're sitting on a bike. Wherever the region of your groin is that saddle is touching, if that starts going numb, you can't feel it, that is potentially an emergent sign. Depending on everything else that you're feeling, once again, you're looking for collective symptoms. Another big sign would be changes in bowel or bladder function. Let's say you've noticed since this back injury, you are either peeing all the time or you're not able to. Or going number 2 has changed your ability to do that, or you're not able to hold it. Okay. Any kind of substantial changes in bowel or bladder function are a big red flag. And these are things that you need to closely monitor, because this could be an emergent situation. And this is very rare. Okay, this is development of something called cauda equina syndrome, which is a medical emergency. This would require surgery. This is quite rare, so I don't want you to hear this and freak out if you hurt your back, if you notice you're like peeing a little bit more the next day. Maybe it's just because you're drinking extra water because you're trying to stay hydrated to recover from this. Don't freak out. You want to look at this collectively. Okay, significant changes in bowel or bladder function. Also, you can't feel between your legs. You have saddle paresthesia. Also, your leg is getting weak. Also, you're getting increased symptoms down both of your legs. This is an indication that you should go to the hospital immediately. Okay? But for the vast majority of you out there, this is not going to be the case. This is not going to be the case. So this is going to apply to most of everyone else. So you let a few days go by. You assess how you feel. A majority of acute lower back issues will self-resolve within 2 to 3 weeks. A majority will. Once again, I'm not getting any good business by telling you this. I'm being ethical and evidence-based. That's the truth. Okay? Majority of low back issues will self-resolve within 2 to 3 weeks. So that's why I say you wait a few days or you wait a week to see what you're feeling. Okay? Because you need to know if it's something that you should address or not. If this is something that is continuing to flare up like multiple times a year, and it's been that way for years, then yeah, you should get it checked out. Don't go, oh, well, Grant, it's probably going to be gone in 3 weeks. But if it comes back every other month, you got to do something about it, okay? But if this is a one-off situation, assess where you're at in a few days, assess where you're at in a week. If things aren't changing, if things aren't naturally improving, then you might want to go get an opinion, okay? Now, when I say get an opinion, listen closely. What does that mean? That does not mean you go and get an MRI. It does not mean you go and get x-rays. It does not mean you go and get a CT. It does not mean you go to a surgeon, an orthopedic consult. It does not mean these things. Frankly, even a primary care physician, there's certain specialties that are trained in lower back issues. There's certain specialties that aren't. Find someone who's been highly trained in musculoskeletal, neuromusculoskeletal issues, or a coach like myself online who deals with these issues exclusively. As well, an online doctor like myself that you see and that you can trust. So don't run straight to imaging. Don't run straight to tests. Very, very, very few lower back issues require imaging. And most of the time the imaging is going to give you false positives and false negatives and all this stuff anyway. And you're going to get a big scary report, and then you're going to be told, oh my gosh, you have a disc bulge, when the disc bulge could have been there for years, never caused a problem. But your pain is being blamed on that. Next thing you know, you have a surgical consult, you're getting injections. That's the thing that happens to a lot of people. Those are a lot of the clients we see. So don't panic. Don't run to imaging. Don't run right to tests. Stay calm. Assess the way you feel after a few days, after a week, and see where you're at. If you are seeing continuous natural improvement, then I encourage you to get moving, get walking, and introduce some, simple rehab movements, whether you found those on my page or someone else, or you got them from a professional. Start to work movement in, or if you're able to regain full function and stay that way, then great. No need for, exclusive professional serious help. Now, if you're someone who's, 1 week, 2 weeks after feeling this, and it's feeling like pretty much the same, you're still getting that morning stiffness, you're still really tight, bending over to put socks and shoes on. Maybe you didn't have sciatica at first. Now you're starting to feel some symptoms in the glute. Now you're starting to feel some symptoms in the hamstring. it is progressing. It's not naturally improving. It is progressing. Now it's time to do something about it. So once again, what do? If you know it's time to do something about it, do you run to imaging? No. Do you run to blood tests? No. Do you run to x-rays and CTs? No. Do you run to orthopedists, neurologists, surgeons, family physicians for this? No. Once again, unless maybe those family physicians are really conservative and really trained in this, which I guess a few out there might be, but find someone who's focused on lower back neuromusculoskeletal disorders. What should you do? Conservative therapy first every single time. This is well supported in the current evidence, the vast body of evidence that covers lower back issues, because it's the number one disability in the world. Conservative therapy first in education. Always, always, always. That's who you go to see first. You come to us in our program, you go to your favorite local chiropractor, you go to your favorite local physical therapist. That's what you do first. That is the best way to get the appropriate treatment on the front end, to not get sucked into the roundabout medical system, to not get sucked into bad information, to not get sucked into scare tactics and all these other things. It is the best way to get proper care and avoid this turning into a chronic issue. Conservative therapy, education, exercise first. Absolutely. So kind of three main steps there that I just really want to hit home. The emergency situation, you just hurt your lower back, okay? Phase one, you just hurt your low back, you're feeling foot drop, you're feeling numbness in your groin region, you're feeling changes in bowel or bladder function. You should probably go to the hospital, okay? 2, you hurt lower back, don't freak out. Let it chill for a few days. Let it chill for a week. Is it starting to calm down? Okay, you're probably going to be okay. I would advise you, get more educated on lower back issues, of course, but you're probably going to be okay. 3, you're a few days in. I'm holding 4 fingers. Oops. 3, you hurt your back. You wait a little bit. Maybe you make some progress, but it ain't going away. It's staying the same. Or maybe you're feeling increased symptoms in the lower back or the leg. Now you do something about it. Okay? You find someone who's going to teach you how to fix yourself. You don't run to the chiro or the PT who's going to just, lay down. Here's your e-stim. Here's your ultrasound. Here's your hot pack, your ice pack, your massage, your roller table. Hey, go get on that bike for 10 minutes. Go walk on the treadmill for 10 minutes. Here's your simple exercise that we're giving every single person in here, no matter what they come in with. And hey, we'll just see you next week, or we'll see you 2 times a week. No plan. Just come in here. We'll do it all for you. You're not learning anything from that. You're not going to get long-term results. Let me save you thousands of dollars right now. Find someone who's going to teach you how to fix yourself and is going to give you a plan. You need a plan. If you have no plan, you will not be able to get yourself out of the situation and sustain the results. If you don't have a plan, you will not learn how to keep these issues better and avoid them in the future. You want to gain something from your plan so that you can maintain certain movements, certain habits, certain routines for the rest of your life to avoid it ever coming back. And you want to get on top of it quickly so it does not continue to progress to a stage where now you're sitting there 3-4 years down the road saying, yeah, I tried this chiro, that PT, all typical stuff. Nothing worked, and now you're turning into a chronic pain individual. That's not what we want to happen at all. And you might be sitting there thinking, hey, I feel like nothing's going to help me. I feel like I've tried everything. I feel like this is just my life now. Yeah, that's not a good situation to be in. So on the front end, don't run to the imaging and all that. Don't run to the cheap quick fix providers. Don't run to the, hey, I just want to lay here and just let everyone do all the work for me. No. Do it right the first time. Find someone who cares. Find someone who's passionate. Find someone who's going to give you a plan. Find someone who's going to guide you, but not do it all for you. They can do the thinking for you, but you got to put in the work. You got to get the education. You got to learn how to fix yourself. And that's exactly what we do in our program. We work with you one-on-one. We're literally walking next to you side by side for an entire half a year, ensuring that you're seeing progress every single week and that you're learning exactly what we're doing, why we're doing it for your situation so that you can maintain the habits and the movements that we teach you for the rest of your life and never have these issues again. That is what you need for long-term results. No quick fixes. 6 months from now, you can have 6 months of progress, 6 months of a waste of time, or 6 months of excuses. You want 6 months of progress because you want to look back 6 months from now and say, man, I'm so glad I invested in myself when I took action now and I didn't continue waiting months and months and months for something to change. You got to make the change happen yourself. You have nothing to lose by investing in yourself. You have everything to gain. You are never going to lose by investing in yourself. No one ever said, man, I really regret investing in my health and learning all these exercises and getting out of pain. I really regret that. No, come on. Don't miss out on the opportunities in front of you that could potentially change your life. Not making a decision is a decision. Not doing something about your situation is a decision. You're choosing to not do something that could get you out of the rut that you're in. That is a choice. So I'm just going to encourage you. If we can help, submit an application, reach out, email me, get in our Facebook group, get yourself around people who are invested and who are committed and who aren't going to accept this new normal as their life. And there are people who want to get back to training, want to get back to exercising, have an active lifestyle, playing with their kids, not thinking and worrying about their low back all the time. That's a life of disability. That's a life of constant worry, and you don't want that life to be yours. So don't miss out on the very opportunity that could change the rest of your life. If you are watching on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review. Join our private Facebook group, RehabFix Low Back Program, so we can get connected and show you what this plan looks like. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.